can make it go. I can open my eyes wider. It hurts like hell. But if I relax, this is what it does. Again, I can pull it. I can use a muscle right here and pull it out and keep it straight. But I'm lifting my eyeball to do that. This is me relaxed. So all day, I'm pulling and retracting or doing something, pulling it up. But I can't do that anymore. Looking left, I'm pushing so hard. So hard. Right eye just glides. Left eye, I'm pushing. And it wants to swing back because I'm pushing so hard. There's so much resistance. Blink and it goes completely in still. Looking down, can't. Looks like I can. The right eye wants to go all the way down. The left eye stops halfway. And even halfway, I'm pushing so hard and trying. So it looks like my left eye goes down, but it doesn't. I'm pushing as hard as I can, but left eye wants to go all the way down. Right eye goes all the way down. Left eye stops halfway. It can only go halfway, and then it wants to go in completely. Or it goes in because it doesn't have the ability to go down. I don't think it wants to swing in. I think it is swinging in because left eye does not have the ability to move the eye down, so it has no other option but to swing in. You can see I can't do this. When I lift up, just looking at up close and looking up, it feels like I'm pulling something right here. It feels like it's just so caught. I just can't do that. Like there's not enough muscle to lift it up. Like maybe the inferior rectus is too low, or it's not able to. I mean, this is how mine wants to be, and I'm like picking all of this part, all of this. I feel like I'm holding up because it just doesn't have the support system. As you can see, it just like sinks. There's nothing there. It's almost like this rolls underneath my eyeball. Like all the muscles that are supposed to be there, it feels like it rolls underneath my eye. So I'm having to hold it and pick it up, which is horrible. Horrible. I can't do it anymore. I just can't physically do this anymore. It's just too freaking hard to see. I mean, you can see when I blink how all this just rolls and goes in and under. So I don't blink. I walk around not blinking and like holding my eye so that I don't get cross vision, or so that I can move my eye. Because when this eye goes so far in, I can't move either eye. It's impossible. So, I mean, can you see what the left eye is doing? I don't know if you can see that, but the left eye, all of the lower eyelid and everything just feels like it is going in and like almost under. It's if you can see that, but this is fine. This springs back. This does not have the ability. It just kind of rolls, doesn't do anything. Can you see that? Again, up, I can feel it all in here. I feel it in here. It feels like it's pulling down here. Left, I feel it here, all in here. Doesn't have the ability to go left, right, and then down. doesn't. See how it just shuts? My eye just shuts. You see that? If I go head down, it disappears. Disappears like this. Disappears like this. Disappears like this. I feel like things were truncated too much and shortened too much and tightened too much, and now my eye has less movement ability. You know, things were sliced and diced, and I have less movement, way less movement than I did before my surgeries. Like, unbelievable. You can see my eye just disappears in the back, in my skull when I do this. Just in my skull. I can't even keep it, my eye open. It's like the eye is retracting in so far. It never did that before surgeries. Like, it just never did that. I mean, it just disappears in my skull. I can't, you know, like, why is it doing that? What happened? What did the surgeries do? What was shortened so much and altered so much that now, like, my eye just sinks in my head when I move? This is so hard for me. I'm considering eye removal because I can't do it anymore. Mentally, physically, this is so freaking hard. My eyes are in pain at the end of the